Deputy Director, IGNOU Regional Center, Vijayawada. Today we are celebrating World Mental Health Day, that is on October 10th, today, 2024. Based on the World Mental Health Day occasion, Regional Center Vijayawada is organizing World Mental Health Day on national webinar on it is the time to prioritize mental health in the workplace. Now I welcome Dr. B.R. Sharma, our Senior Regional Director, will give the welcome address. Sir, please.
Good morning, all of you. Myself, D.R. Sharma, Regional Director, IGNOU Vijayawada. As expressed by my colleague, Dr. Prasad Babu, I cordially welcome on behalf of Regional Center Vijayawada, respected Regional Director, RSD, Director, SOSS, faculty of the Discipline of Psychology, Regional Directors and colleagues from all other RCs, academic counselors, coordinators, students, and the expert, Dr. Vimala Madam, to this webinar. My colleagues, Dr. K. Sumrata, Dr. Prasad Babu, Deputy Directors, and other colleagues from the RC Vijayawada, welcome all of you to this national webinar. The occasion is already informed by Dr. Prasad Babu. Mental health is equally important along with the physical fitness and health. Normally, physical fitness will be taken care by the employees and their own as and when it requires. But sometimes, if not all the cases, sometimes in some cases, they ignore this mental health due to lack of awareness. So it is the responsibility of the organization to create such awareness among the employees about the mental health. With this view, we are conducting the national webinar today on the World Mental Health Day. With this background, I welcome all of you once again to this national webinar and request Dr. Prasad Babu, Deputy Director, to explain more about the background of the webinar. Over to Dr. Prasad Babu.
Good morning to all. Today is the World Mental Health Day. So every year, World Mental Health Organization is conducting Mental Health Day on the 10th October every year. So American Psychological Association and World Health Organization also mentioned that every person requires and maintain proper good health. So good health means not only physical health, we have to maintain mental health also. So the person needs two types of health. One is physical health and second one is mental health. So without mental health, we cannot run our daily living and we cannot coordinate with the others and we can't live in society. So based on all the aspects, World Health Organization and American Psychological Association have decided to conduct the World Mental Health Day for last 20 years. Now, this year, World Health Organization mentioned that to prioritize the mental health in the workplace. So, World Mental Health is more important. World Mental Health Day is celebrating entire world, especially in India. Government of India, Ministry of Health and Family Welfare, they are also conducting the awareness camps entire India in wealth and health wellness centers, wherever the wealth and wellness centers available in the country. Even in Andhra Pradesh also, each mandal and each primary health center renamed as a health and wellness centers, health and wellness centers. So all these centers are creating awareness among the public regarding their mental health. The theme emphasized the urgent need to address mental health in professional environments where stress, burnout, and mental health challenges are increasingly prevalent. The day serves as a reminder for organizations, including corporations, universities, and government sectors, to create a supportive and inclusive culture where mental health is a priority. By raising awareness and promoting policies such as mental health resources, flexible work arrangements, and open communication, World Mental Health Day 2024 aims to reduce stigma and foster healthier and more productive workplaces. This global effort encourages employers to view mental well-being as integrated to both employee satisfaction and organizational success. So this is the situation, and World Health Organization mentioned theme, and briefly just I informed the few information. Now Dr. K. Sumulata, Deputy Director, Madam, will introduce our resource person, Professor T.D. Vimla.
Thank you, sir. A very good morning to you all. As we all are aware, World Mental Health Day is celebrated on October 10th every year to raise awareness about mental health and to mobilize efforts to support those experiencing mental health issues. The theme for World Mental Health Day 2024 is Workplace Mental Health. The theme highlights the importance of addressing mental health and well-being in the workplace. IGNOU Regional Center Vijayawada is organizing this webinar on the same theme. That is, it is time to prioritize mental health in the workplace. The resource person for today's webinar is Dr. T.D. Vimla ma'am. She is working as honorary professor in the Department of Psychology in Acharya Nagarjuna University, Guntur. Professor Vimla ma'am has a vast teaching experience of 40 years and 10 years of administrative experience as well. Ma'am has guided a number of research students and published 14 books. She is actively involved in a number of academic activities like organizing psychology seminars and conferences, exhibitions, conducting stress management workshops, extension activities, observing important days related to the field of psychology like Mental Health Day, Suicide Prevention Day, Happiness Day, etc., with seminars and awareness camps. Her professional achievements include receiving the AP State Best Teacher Award in 2007. Very recently, ma'am has received the Change Maker Award in the academia category at the Making India Employable Awards. This award was given by the India Education Forum and India Employer Forum. She has served as BOS chairman for UG and PG psychology. She is an academic advisor for the psychology course of Acharya Nagarjuna University's Center for Distance Education. She is also the coordinator for two massive open online courses, MOOCs, of ANU. One is Guidance and Counseling Psychology, and the second, Child and Adolescent Psychology. I am very happy to inform you all that ma'am is also associated with IGNOU since 2011. She is approved academic counselor for our MAPC and MSc CFT programs and evaluator for the projects and internship for these two programs. She is also a member of many professional bodies like World Congress of Psychologists, Global Association of Counseling Psychologists, Indian Academy of Psychologists, to name a few. As we set out on this 1 hour intellectual journey, we hope that the webinar will offer all participants a plethora of insights, enable fruitful interactions, and inspire fresh perspectives about the topic at hand. Thank you. I now hand over the session to Professor Vimla ma'am. Ma'am, welcome.
Thank you. Thank you, Dr. Sumalata. And thank you to all the faculty, all the members of the regional center, Director Sharma Garu and Dr. Prasad Babu Garu, Dr. Sumalata Garu, and other faculty members. Good morning to all. And this is a happy World Mental Health Day. Let us be the champions of mental health awareness program in India. With this motto, we will start the program. And basically, what we want to, before starting this, the entire session will consist of knowing about what mental health is and what is the importance of mental health in every individual's life, and how just a screening of what is the status of our mental health at present. And later we will go how to manage, what are the aspects which are creating, which are disturbing our mental health. Also with a screening test we can identify, and also how we have to manage the things. In addition to this, we are going to the workplace. What are the factors which are creating workplace, which are disturbing the workplace disturbing the mental health of at workplace, and what are the factors and how to manage it. So the personal mental health and workplace mental health are both are related. Hence, once you have to understand the what is personal mental health, it has a ripple effect. If you are personal mental health is you are personally having a good mental health, it also extends to workplace too. And some of the workplace factors are also add to this. That's okay. So let us start with the introduction of what exactly mental health is. All of us know what physical health is. Physical health means we are comfortable with our physical body with no symptoms. We are able to do our daily routines without any discomfort. If you are having pain or something or some disturbance or discomfort in your body, immediately you rush to a doctor and he will and you will go for the treatment, and you will remove for the treatment you go to a doctor. This is everybody knows this. Coming to the, when you are having mental illness, that is, you are what is this? What are the symptoms of mental illness? Most of you, we don't feel the symptoms at all. Sometimes irritation, anger, sadness. Sometimes our behavior is irrational behaviors and irrational thoughts, continuous negative thoughts, and aggression. All these, if you are experiencing continuously, excessively, having all this is common. But if they are excess and if it extends for longer periods, then you have to understand that you are not mentally well. The thing is, when you are having all the symptoms, as I said above, then people will think, I am angry because of so and so person, because I am irritable because of so and so situation, because I don't like that situation. For all these factors, what I told you, anger, sadness, or irritation, or irrational thoughts, for all these, we try to find out a reason and justify our behavior. And we never think it is because of us. It is something is going on in our side. We don't think. And we don't want to correct it because we are all justifying our behaviors. Hence, we don't feel it as an illness. I'm getting this because of that event. Everybody wants to justify it. If the other person changes, then my irritation will go away. But this is the condition which is existing in the society. Hence, we don't identify mental illnesses. We are not able to identify our mental illnesses because of this justification of our mental irritation or anger. So this is happening because of the particular person. This is happening because of so and so situation made me. The environment made me like this. These are the things we always justify our behaviors, and we don't feel it as mental illness. This is the reason we don't go for we don't want to correct ourselves. We always want the correction from other side. So this is the factors of mental illness. So you have to identify that if these factors continues, having now and then is okay. If it is continuous for a longer period, then you have to think that something is wrong with you in your mental status. So this is called mental illness. Mental illness. Then this is why this is important. Then and other important thing is there is a relationship between physical health and mental health too. If you are having continuous irritation, anger, and all these things, all these psychological factors brings a lot of changes in your body. That is biochemical changes occurs. Your brain and nervous system react to your anger. Brain and nervous system reacts to your aggression. Brain and nervous system react to your depression. Like that, brain and nervous system, heart and cardiovascular system, because of your anxiety and all the things, and your endocrinal system, all the internal parts of the body will get reacted to all these things. So, if you are having a continuous prolonged symptoms of mental illness, it affects your health. It affects health. So this is psychological, mental aspects are affecting your physical health. Like similarly. So this is your experience too. If you are irritated or something, you experience a headache. If you fight with somebody, this is a psychological aspect. When immediately you feel like having some tiredness or headache. This happens. And similarly, there is also a relation between physical health and mental health too. For example, a person is being diagnosed as cancer. He's being diagnosed as cancer. Then what will be the psychological condition? He will become depressed. Or the first time the person is being diagnosed as a diabetic person or hypertensive or cardiac, whatever is that, this has an impact on your psyche. You will become sad. You develop anxiety. You develop depression. Whatever is that, sadness is, this is the psychological symptom. So now we can understand body and mind. They work together. So the wellness of the individual is being determined both by body and mental health, psychological health. So because in India, mental is word is not it is used derogatorily. Let us say psychological health. Psychological health. So of course, mental is being accepted everywhere. So when I am talking about mental, there is some objection from the public. Mental is not it's used derogatorily in some of our cultures. So he's a mental person. That's be a derogatory term. Hence I am telling it. So hence body and mind, these are two related. Two are related. If one thing is affected, it has an impact on our second part. This is another thing. This is the thing. So our body and mind are related, and individual's wellness is being determined by their body as well as mental health. So if your mental health is not well, even your efficiency decreases. This is another thing. You cannot reach the goals what we intended to reach. So your efficiency decreases, and also your health, you loses your health, your efficiency decreases psychologically, you lose your peace of mind, and also you will have conflicts, you lose your social relations too. Hence you have to address it immediately and be the champion in awareing the people regarding mental health. So let us think about the present scenario. Let us think about the quality of life. Coming to the thinking about the previous generations, we are having a better quality of life compared to our previous generations, because our quality of life increased, and we are taking good food, mineral water, whatever is that, we are taking care of our physical health. In spite of this, the diseases are increasing in the society. So the n number of hospitals we see everywhere is the indication that our physical health the diseases are increasing throughout the world, not in India or not in some place. The diseases are also increasing. So people, this is a contradictory thing. The quality of life is increasing and diseases also are increasing. So in this context, lot of research was conducted on this. I'm not going into the research, and some of the research found there are two main reasons for increasing of diseases, increase in the diseases. One is being, they identified major reasons. I'm not going into detail, major reasons. One of the major reason is environmental pollution. So because of industrialization, whatever experiments we are doing, we have muddled the environment, and this brought a lot of changes in the environment, which is a major causative factor for our diseases. So which everybody knows, the government and UNO is taking lot of things, lot of action to bring the for the environmental protection at large scale. This is one thing. The second major factor which is being identified by the researchers is the mental health. They identified three aspects. What you can say, trio, SAD. SAD means stress, anxiety and depression. Stress, anxiety and depression. SAD, trio. These three are mainly responsible for our physical disorders. These all three are psychological factors. What is that? Mental health, related to mental health. So, stress is one thing, anxiety is one thing, third thing is depression. These are the three aspects. So, lot of, again, these trio are being identified as the major cause for, and some of the research has found more than 60% of the disorders are being experienced because of this trio. Physical diseases, I'm talking about physical diseases, are being experienced because of this trio. And some of the research statistics is showing that more than 24 point something, some of the research statistics telling that more than 24 point something percentage of people in the world are suffering with these three disorders, either anxiety or depression or stress. Stress is being identified as major factor for disturbing our health. So stress, why stress means, you can understand why these three disorders were become so prevalent in the society now. Because we all know that many changes are occurring in the society which are so rapid that the people are not able to adapt, and evaluating them as dangerous. The evaluation of the individual about the environmental condition as dangerous, as threatening, creates stress in the individual. This is only my evaluation. Whether my evaluation is right or not, that's a different story. I am evaluating these conditions as threatening. Then I am developing stress. Stress means it is a process which brings biological changes, psychological changes, and also behavioral changes. Stress is a process which is being occurred because of your evaluation as dangerous. I evaluated some of the things as dangerous because then I develop the process of stress happens in my body. So physically body reacts, psychologically body reacts, and also all these three behavioral changes occurs. So stress is nothing but the evaluation. Because of uncertainty, we don't know what is happening. The anxiety is the worry about the future events. Worry about the future events. Anxiety is the worry about what is going to happen in future. That is anxiety that is happening because of the uncertainties prevailing in the society. And also the depression. These are the triad. For this triad, the main reason for this triad is the is causing difficulty in our mental health. This is causing difficulties in our mental health. So these are the research identified that. And another important thing is also identified by the people are not aware of this importance of the mental health. Hence, in 1992, first time WHO has declared October 10th as World Mental Health Day. World Mental Health Day. The main purpose of this to aware the people regarding the importance of mental health. To aware the people regarding the importance of mental health. This is with an objective of number one. Mental health is also important and it is playing a major role in an individual's life for efficiency, for social relations, for physical health, for psychological health, and social relations too. For all this, mental health is playing a major role. This is important. This should be given awareness to the public. So with this objective of awareing the people regarding the importance of mental health, the World Mental Health Day was declared by WHO, World Health Organization. World Health Organization declared it in 1992. This is one thing. And second objective of this World Mental Health Day is second, removing the stigma related to mental health. If I am having a physical ailment, I will announce. But if I am having a psychological factor like depression or anger, I don't announce it. I don't announce. There is a lot of stigma even today. Even today, what is happening is people are feeling still stigma to approach a psychiatrist or a counselor. Of course, slowly the stigma is being removed, but stigma still exists to say I can manage myself. This is the, and having psychological disorder is being treated by the individuals as a shameful thing. Why I can manage myself? I can manage myself. This is the idea of many of the attitude of many of the people. Hence, so you might be seeing the stigma is slowly removing. Some of the celebrities are announcing that I am being depressed. I am under treatment for depression. So these are very recently some of the celebrities announced this to overcome the stigma among the people. So these are the two main objectives of World Health Organization to declaring World Mental Health Day to aware the people regarding the importance of well-being, the importance of mental health for their well-being. Everybody wants, the goal of life is happiness. Happiness. Without mental health, there is no health at all. There is no health. Many people used to say without mental health is prime factor for our physical health, social health, for efficiency, and also for our success also, and social relation. So to give this importance of mental health, this World Mental Health was declared in 1992. Every year they are making the awareness programs to different people, workplace, adolescents, children, and all different age groups as well as and different factors like depression, anxiety, like that. They are giving awareness from then onwards till today. Every year they are taking a theme on that and the government's role. What are the stakeholders for awareing the people regarding mental health awareness? This is a big mission. Big mission. Awareing about mental health is not a small thing. It takes years. Hence, the government has taken, even Indian government has taken many programs, even in India. National mental health programs are being designed and implemented, as Dr. Prasad Babu has given. They are being given by Health and Family Welfare Ministry has taken this activity of developing national mental health programs throughout the world. And many NGO organizations are taking part in this along with this. And we are all of you know the main key role in this mental health programs in India is being given to NIMHANS Bangalore as a center for wellness. This was established in the NIMHANS, and this the main centers for awareing the entire world. They have used so many programs and also tele-counseling they are doing, and all the primary health centers, they started this mental health awareness programs. Nearly 300 districts, they started this program on mental health awareness through primary health centers, even including in villages, including in villages. So this is the condition. Now, this is the present scenario of world mental health. Now, coming to the whom we can call him as a mentally healthy person. Mentally healthy person. This was we call a person as a mentally healthy person if he is able to use his ability fully. I am having lot of ability and I am able to utilize my abilities. Number one. Then the second aspect of a mentally healthy person is I should be able to manage the daily stressors. Every day we come across with many stressors. Stressors means the things which are creating us stress. Many stressors at home, in office, in society also. We are getting so many stressors. If I am able to manage the daily stressors, then I am mentally healthy. And third thing is, I should develop good interpersonal relations. Good interpersonal relations at home, at office, and in society, all the three areas. So, then, and I should also contribute to community. I should do something because of my abilities are not exclusively for me. I have to contribute to community too. If I am mentally healthy, I will do all the four things. One is being able to use my potentialities, able to manage my daily stressors, and third thing is develop good interpersonal relationships, and fourth one is contribute to community. Something I have to contribute to community because I am taking so much from community and society. There is a need for me and responsibility for all of us to contribute to community in whatever way you can. So, if all these four things are being done by an individual, you can say that the person is mentally healthy. Mentally healthy. It doesn't mean mentally healthy doesn't mean he is absolutely 100% he is having all the he is able to manage. No, this is a scale. If most of the times he is able to do all these things, then we can call him as mentally healthy person. So this is about personal mental health. Personal mental health. So there are number of things which contribute for our mental health. And there are so many diagnostic tests for knowing about our physical health. But because we are not at all focused on mental health till now, just we are I'm giving you a screening test. Just a screening test to know what is the status of my mental health. I said if I am having all the four characters, I may be called as a mentally healthy person. I may be called as a mentally healthy person. So in this scenario, let me say that what is the, how can I know about my mental health? If I am having irritation, I'm blame somebody. I'm blaming it for some reason or somebody or some situation or some individual, whatever is that. Blaming all the institution too. So how can I know about my mental health? Just a screening test. Remember, this is not an assessment. I'm not assessing. It is a screening to know how mentally healthy you are. Now, I will tell you some of the traits. I think all of you, if you are having paper and pen, just simply within 5 minutes, you can assess yourself and you can say that what are the areas where I have to focus upon to improve my mental health. This is the main idea. So why I am taking all this information is, if you are personally mentally healthy, it has an impact on your psyche too, on your workplace adjustment too. So let me say that I will tell you some of the items and you have to
you have to assess it on 4 points. One is never, and second is sometimes, third is often, and fourth is always. Fourth is always. So I will read out one after the another. You can put only the numbers, whatever applies to you. Anxiety. Anxiety, what we call in a normal language, anxiety is being called as tension. If you do you feel tense? Do you feel tense? I never felt tense. Anxiety, put number 1. If you feel that sometimes I used to feel tension, put number 2. If you feel that I am getting tension often, you know what often is. Often, then put 3. And if it is always, put 4. So the first item is tension or anxiety. Put only the number, you put numbers only, not you need not write all the things, put your number. Second thing, discomfort. Psychological discomfort means uneasiness. I am in a class. I am feeling very discomfortable in the class. I am discomfortable at home. I am discomfortable in office or with friends. So discomfort is the second thing which is being identified. If it happens, never put 1. If it is sometimes put 2. If it is often 3. And if it is always 4. And the third thing is loneliness. Loneliness, if you feel it, never 1, sometimes 2, often 3, and always 4. Loneliness, do you feel lonely? And then sadness or depression, we don't call it as a depression unless it is long period. Sadness, never means it is not honest answer, I can say that. Never means. And sometimes, often, always. 1, 2, 3, 4. Then anger. Also, never, sometimes, often, always. Then coming to the next 6th one. Do you often experience headache? Or do you never, sometimes, often, and always? Headache. Then fatigue means tiredness. Tiredness. Without any reason, without doing anything, if I feel tiredness. Tiredness is never, sometimes, often, and always. And insomnia means lack of sleep, not able to sleep well. Not able to sleep well. I'm not getting sleep. Many of the people are complaining now. Not able to sleep well. I didn't get sleep. Insomnia. Never, sometimes, often, always. Then we'll have body pains, shoulder pain, back pain, pain without any reason. We'll get back pain, shoulder pain, neck pain. The pains, experiencing of body pains. So this is also you have to count it in 1, 2, 3, 4. Never, sometimes, often, and always. Now, I have given you 10 points as a checklist. You wrote, I think, you have written some of the numbers against each of them and add all these things. If your score is between 10 and 20, if your score is between 10 and 20, you can say that you are having excellent mental health. If your score is between 20 and 30, you are having average mental health. And if your score is between 30 and 40, you are having very low mental health. You should address it immediately. You should address it immediately. So these are by this you can understand whether you are having. Again, I will tell you the items which I was given in the test are, some are psychological symptoms, some are physical symptoms. So both are important for mental health. So because both of them have an interrelationship. Both are interrelated. Both are interrelated. Now you can say that you might be having an excellent mental health, but still you are facing some of the problems. You might be having an average mental health, still you are facing some problems. Like that, now you have to find out where your problems are. I will give you some of the things where your problems are. What are the area where your problems are being given? Let me say that one is about problems related to health. Now you score them into 1, 2, 3. 1, 2, 3 only. 1 is rarely, 2 is sometimes, and 3 is often. Rarely, sometimes, and often. 1, 2, 3. Problems related to physical health. Suppose if you are having problems related to physical health, if you are having the problems related to physical health, then 1, 2, 3, are you getting problems in rarely, sometimes, or often? So if it is 3, often the physical problems or health issues are disturbing your mental health. This is the area where you have to address what you can do for your physical problems. You have to, if the problem is a temporary problem, we have to enhance it. If there are certain disorders for which there is no cure, you have to manage them. You have to manage them without any stress. That is important. Because you are being affected with all this, you have to manage it and reduce stress. Be careful in managing them. So it doesn't mean that knowing mental health will remove all our problems. Sometimes we have to learn to manage them also. The second thing is problems I am not able to manage your daily stressors. You will have daily stressors, means more dangerous than occasional stressors. Daily stress is very, very dangerous, which affects our health in long term. Daily stress at home with the family members. Daily stress at office with the boss and colleagues. These are the two important areas. Daily stress within yourself also. Sometimes I used to feel stressful about my abilities, my personality, my things. So these are the daily stressors. So what research is telling is occasional stressors has not much impact on health, whereas daily stressors has a lot of impact on your health. So identify whether you are able to manage your day-to-day life stressor. You cannot remove stress. You cannot remove stressors. They are part of our life. They are part of our life. You cannot remove them. You have to keep them with us. You have to keep them with us. So, and manage them. You have to manage them. So, for this, how do you identify this? The best way to identify for 3 or 4 days, you write down from morning to afternoon what are the events which are creating stress to you at home or office. And again, during the end of the day, you find out what are the things which are creating stress to me. Second day, third day, like the 3 days, if you write down about you journaling means writing when do I experience stress and what are the reasons. So if you write down like that, these are the areas which I have to address. You can find out. Today I got 10 times I am angry with the different situations. At the end of the day, I understood that there are 10 times I was angry. Then what I have to do in my journaling next day, I want to reduce it to 6. So these are the unnecessary reasons for getting angry. So let me stop those things and do some other and reduce my anger, because it is hurting my physical health too and my well-being, my happiness. So like that, through journaling, we can address some of the stressors, daily stressors. Then problems in relationships.
So where I am getting problems in relationship? Most of the time, the problems at home, family problems and in relationships are more. The psychiatrists say 90%, more than 90% of the cases for counseling are in relationships only. Unable to develop good interpersonal relationship at home, and sometimes in counseling we will, if it is creating problem to you at home or at workplace, you can go for counseling. The very first thing is, it is an adult interaction where criticism and judgment, if you criticize or judge the other person, then the relations will reduce. Relations will reduce. And these are the very important things. Some of the, I'm not going because the time is up. So here, problems related to relationship, addiction problems. If you are having an addiction problem, better you have to go to a de-addiction center, not only for alcohol and drugs, for even for journaling also helps you if it is a internet addiction or porn addiction or whatever is that. Definitely the journaling will definitely help you. If it is severe, you have to consult a de-addiction center. Then problems of anger and sadness. Problems of anger and sadness. And the problems related to workplace. So what are the problems? If you identify them, put 1, 2, 3. Am I creating problems? Once it is okay. Rarely used to get problems in all the areas. If it is sometimes 2 means you have to find to make it 1. If it is 3, you have to address it immediately. Otherwise, you are losing your health. You are losing your health. If it is 3, you have to often, if you are having problem of this, you have to address it. Remember, you are responsible for your well-being. Don't blame or don't make others as responsible for your health. You are only responsible for your life. Your decisions, your behavior, your abilities, you are responsible. The individual is responsible for managing all the things in life and developing mental health. You cannot change the situations. You cannot change the stressors. You cannot change the world. What you have to do to develop good mental health is, you have to adapt, not passive adaptation, active adaptation to the changing social scenario, whatever, wherever is the place. That will help you to develop good mental health. Coming to the workplace mental health. So this is all this about. So what you have to do to develop the, basically, one important thing is physical exercise, which changes so many, which brings so many changes in your body functioning. So do physical. Relaxation is important. Physical exercise at biological level, and mental relaxation either by meditation or some other relaxation techniques. You can yoga or some other things you can choose, mindfulness or some other thing. Then and journaling is the basic thing. These are the important things which you can do to manage yourself. If it is severe, you can address it. You can consult a counselor. Then coming to the mental health at workplace. Mental health, because of the globalization scenario, the work environment, there is a lot of change in the work environment. You might be knowing, because of globalization, the competition enhanced. Abundant, big competition is existing in the society. At the same time, the opportunities are also increased opportunities. These are the 2 things that happened because of globalization. Enhanced competition and increased opportunities. This is the time where there are n number of opportunities are prevailing, which needs abilities as well as personality is also very important. Personality is also important. So there is a because of this increased competition, there is a changing social scenario at work environment. There is heavy competition in all the organizations, whether it is a public sector, more in private sector and more in public sector too. It wants to
compete with private sector and enhance the facilities to the public. So in this scenario, there is heavy competition is existing. So it resulted in overload of work for the employee. It resulted in frequent changes, rapid changes in the work scenario. And also it brought long hours of work, which is creating lot of stress and workplace. There people are losing mental health at workplace. Earlier, workplace is to be enjoyed, but people are not enjoying the workplace. They are especially the IT industry and other in all everywhere. The competition is not in IT industry alone. Everywhere in colleges, in universities, whatnot, in every, because of the competition. Because of the competition, it is everywhere. Hence, the changes are everywhere. Then the extended workload, increased workload is also everywhere it is there. These things we cannot change. We cannot change. And the result is the entire society is developing. So you cannot arrest all this. There are also discriminations, inequality. All these are being identified in the environments, in the work environments too. But for this, who is suffering is, there is from coming to the work area, the research says last year globally 12 billion working days are lost. Every year, nearly 12 billion working days are lost because of lack of mental health, because of the mental health. And also, he said, because of these three sad triad, stress, anxiety, and so when the individual is, employee is affected with all this, the working days are being lost. And every year there is a $1 billion are being lost every year because of this work stress. So this is happening. This is happening, and the mental health of the employees are going down. That's why this time the WHO has taken this as a priority. So it has given guidelines. WHO has given guidelines to all the organizations to follow and develop a good environment, congenial environment at workplace, like for organizational interventions, managerial training, and worker training, interventions, individual interventions, and appointing a counselor in the workplace, and addressing each individual's mental health. So employee is important. He is key for any organization. If he is suffering with mental health issues, the organization cannot progress. Hence, the government has given, WHO has given guidelines to the organization to inculcate all these in the organization to protect the mental health of employees. Okay, this is good. The organization is doing so many things for the employees. They are using different techniques, but all these are not being found as effective. Hence, this year, WHO also given some of the guidelines to the organization. Okay. So, these are the guidelines given to our, at individual level, what we have to do. This is also, it is for organization. As an individual, I am the employee. I should take care of that. You cannot change the work environment. You cannot change the policies. You cannot change the organization rules and all the things. You cannot change. Understand what I can change and what I cannot change. Keep it always in your mind. What I can change and what I cannot change. Here, coming to the at individual level, can I change the policies? No. As an employee, I have to just follow the instructions given by the policies. So don't put your mind in the policy, whether they are right or wrong. Don't think. So just execute. Your role is only execution role. Number one. Number two. So in spite of all this, you will have a heavy workload. This is also there, and a lot of things are happening. For that, to keep your mental health, the very first thing is develop good interpersonal relationships at workplace. This is very important, very, very important. If you have a team of people who can share, how can I develop good interpersonal relations with people in the office? You can develop good interpersonal relations. Remember, AGES, AGES, AGES. A stands for through your appreciation. If you appreciate your colleague, it is very difficult to appreciate our colleague, but appreciate. Then they will become close to you. Show gratitude means thanks. If they did anything good for you, any help for you, say you'll be. You can say thanks. Gratitude, appreciation, gratitude, and empathy. Understand the feelings of other person. Understand the feelings of other person. And fourth, yes, yes is most important, which says that sharing your experiences. Sharing your experiences. You can share your experiences also within 5 minutes. I am going to close this. So share your experiences. If you share your experiences, whatever is the experience, not only the academic or whatever is that, not only the work experience, whatever is it, if there is somebody to support, social relations enhances your mental health. So this is the first thing which is in your hands. You can do that to reduce your mental stress. The second thing is, anyhow, you have to adapt to the situations which are arising at the workplace. So, yeah, flow behavior is very much needed. Flow means whatever the work given, you involve in that and do the work. If you don't involve in the work, you feel stressful. Please involve in the work. It is inevitable. Once you are an employee, you have to do the work. Anyhow you are doing, you involve in the work. That is called as flow behavior, which reduces our mental health. Involve in the behavior. Number 2, fee. We can say that enthusiastic. Fee. F means flow behavior, involving. E means be enthusiastic. Anyhow I have to do, if I am enthusiastic, my mental health will be okay. That is, and be energetic, taking good nutrient food and all the things, be energetic, so that you can fee behavior helps you to work well in the office in spite of the lot of changes or rapid changes are occurring. So develop the attitude to learn. 4 important things. If the work attitude to learn. So these are the personal level, how I have to make my thing is making good interpersonal relations and having a good atmosphere for me. And then second thing is, it is in our hands only. Second thing is, it is not based on others. It is in our hands. Third thing is fee behavior. Fee means flow in your behavior, enthusiastic, energetic. And for adapting yourself to new changes in the organization, you develop the attitudes to learn. Anyhow, I have to learn new things. So learn attitude. And then if the work is very heavy, in between, take some breaks and do some breathing exercises, which reduces your stress and make you mentally healthy. Finally, so for bringing about, finally I am concluding with this here. So organization level they will try, and an individual level you have to try. That is in your hands. Organization trials are not in your hands. What you have to do is to bring about changes in a situation. Awareness about mental health. Just now we had an importance on awareness, attitude, and practice. These 3 are important. Only awareness is not sufficient. Awareness, attitude, and practice. By these 3, we can bring about changes. We can develop our mental health. Not only developing our mental health, you should be a champion, awareing other people also on importance of mental health. Thank you very much for giving me this opportunity. I wholeheartedly thank the RC Vijayawada for giving me this opportunity to share some of my ideas of mental health today. Thank you. Thank you, sir.
Thank you, madam. Thank you very much for the excellent talk. Before I request Dr. Prasad Babu to propose the formal vote of thanks, there are some participants are willing to ask some questions.
Yeah,
Can
I'm
you
ready
answer,
to
madam?
Yes, I'm ready.
Okay. The one person has raised their hand. They can ask their question, please.
Yes.
Parveen, you want to ask something? Parveen has raised the hand.
By mistake. Okay, no problem. Is there any other participant who would like to participate and interact with madam?
Sir, small request, sir, small request. Can you share this PPT to with all participants, please?
Definitely, madam. Definitely, sir. Definitely. We will be sharing with the permission of the
Thank you,
expert.
thank you, sir.
Even the recording also will send you, sir.
Thank you, sir. Thank you very much.
Now I request Dr. Prasad Babu to propose vote of thanks.
Good afternoon to all. On behalf of Regional Center, Vijayawada, I would like to thank Professor T.D. Vimla ma'am from the Department of Psychology, Acharya Nagarjuna University, for being our resource person on this special occasion of World Mental Health Day, that is on today. Madam, your valuable insights have greatly enriched today's event, and we truly appreciate your time and expertise. Since you are having 40 years of experience in the field of psychology and mental health, so really those who have participated today in this meeting, definitely I think they will get they get the benefit, and they get some opportunity to listen your expertise. And also, I thank Dr. B.R. Sharma, Senior Regional Director, for your constant support and guidance to conduct this program. And Dr. Sumalata, Deputy Director, Madam also participated to organize this program, and we all coordinate with the concerned people and coordinate for organizing the people and talk with the headquarter people and all the things. Thank you, ma'am. And I also thank the staff of Regional Center Vijayawada and technical support. Those are providing this technical support for conducting the online webinar. For them also we thank. And our coordinators, really pillars of the regional centers and IGNOU, LSCs are the pillars. So our coordinators and functionaries of learner support centers for their hard work in making this event as a success. Finally, I thank all the students, those who have participated in this event, especially MS Psychology and MSc CFT students. Another thing also, MSc Psychology students of Acharya Nagarjuna University also joined 2-3 persons. Thank you very much for all the things you have participated today, national webinar. Thank you, one and all. Thank you.
Thank you, madam. Thank you once again.
Thank you.
With your permission, we would like to close this session now.
Okay, thank you, sir.
Okay, ma'am. Thank you.
Right.